Heart to Heart on ABC 27 is brought to you by Penn State Milton S. Hershey Medical Center.
Welcome back. Here with me now is the Program Director of General Cardiology, Dr. Peter A Laguna. He's here to share his story with us. Thanks for being here this evening.
My pleasure.
Let's go back to September 2009. What happened?
Well, on September 20th, Sunday, my wife and I played some golf, got home in the afternoon, and I was sitting at my desk doing some paperwork or email, and that's the last thing I remember, because a little while later, my wife found me unconscious at my desk.
What happened next?
Well, she couldn't arouse me. She said I was cold and clammy, and she called 911, and EMS came, and I was taken to the Hershey Medical Center.
And what did they do there?
Well, it took them a while to figure it out because nothing obvious was wrong with me except the fact that I was unconscious. Blood pressure, heart rate, all the tests that were done. But they did finally do a CT scan of the chest, which revealed what's called an aortic dissection.
And how did they handle that?
Well, that's an emergency, life-threatening situation, and my surgical colleagues came in to operate on me overnight, and thank goodness they saved my life. I think they saved my brain, and I'm very happy to have had them taking care of me.
I mean, you seem like you're doing fine today. It's like nothing ever happened.
Well, I'm not as strong in some ways as I was, but I'm back to work. I'm enjoying my family and friends and doing most of the things I was doing before.
And you said you got to see your daughter graduate?
Thank goodness. I got to see my daughter get married. I got to meet my first grandchild, so it's been a really good last year or two for me.
Okay, Dr. A Laguna, thanks so much for sharing your story with us. We'll send it back to you, Chuck.
A wedding and a grandchild, that's why they do these procedures. That's why this all works. And joining us now on the desk, Dr. Michael Lazar, cardiothoracic surgeon. I messed that up the last time I talked to you too, but you know, there was a high-profile case a few years ago of actor John Ritter involving a heart problem. How about summarizing what that is? Because there was a lot of misinformation that went out with that.
Sure. So John Ritter had a type B dissection, which is a dissection of the aorta that comes after the head vessels. Dr. A Laguna's was the more serious of the two. Dr. A Laguna's was a surgical emergency. Most people like John Ritter are treated with medicine nowadays, or something like this. This is a thoracic stent graft, and so this tube gets placed inside the aorta through a small cut in the groin that vascular surgery and cardiac surgery does together. And we can put this in and expand it inside of the aorta. And so John Ritter's aorta had ruptured. It tore through the wall, and the blood leaked out into his chest. And had they gotten there in time with something like this, he could have been saved. Dr. A Laguna's story is a little bit different. His tear was in the aorta, the main tube coming out from the heart, right above the exit of the heart before it gets to the brain vessels. And the lining of his aorta had actually torn off and was stopping blood flow to his brain. And so we were called in that night to help put those things sort of back together. They had a picture up there of that.
Put it back up there again if you can. What are we looking at there?
Right there towards the middle, that white stuff is the contrast in the heart, and that circular area up towards the middle, towards the top, that's one of the arteries that goes up to the brain, and that is that lining of the aorta that had torn off and was blocking blood flow to his brain. That's why he had passed out, and we had to take all that and put it back together. And that's the sort of stuff that we do at Hershey all the time.
Okay, well, an amazing procedure. It's amazing. I didn't know my aorta was this big.
Absolutely.
That's amazing. Thank you, doctor, for joining us here
My
tonight.
pleasure.
And we go back now to Debra Pinkerton in the ABC 27 call center.
Thanks, Chuck. As you can see, the phone lines have been busy. The specialists are on the lines. The phone lines will remain open until 8 o'clock, 346-3333, or send your questions to abc27.com. Here is the last question. Several years ago, I was diagnosed with mild aortic stenosis. How bad does it have to get to have the valve replaced? Is this procedure dangerous?
Well, generally speaking, aortic stenosis needs to be moderate to severe before we replace the valve. And this is an exciting area of research now, and new treatment options are coming to be available that will permit replacement of the valve without open chest surgery. So not too dangerous now, and it's getting better.
Okay, thank you so much, Dr. Kozak, and we want to thank all the specialists here for answering your calls. Chuck?
Thank you, and we want to thank all the doctors and all the specialists that shared their information here tonight, and thank all the viewers for their calls and their emails. And if you'd like more information, or you'd like to schedule an appointment with Penn State Hershey Heart and Vascular Institute, simply call 1-877-467-7484, or you can visit online at pennstatehershey.org/heart-and-vascular. Thank you again to all the doctors and specialists, and thank you for watching and listening, and to all, as always, good health.